I'm Kat. Welcome back to my channel. I am recording in my bathroom because today I want to talk to you guys about oral hygiene. We can't go to the dentist. Most of the dentists are closed because of the quarantine. And so the inability to go to the dentist, it's even more of a reason why we need to take care of our teeth. So you guys know that I'm a licensed RDA. I have done just about everything in the dental field, from implants to dental surgeries and orthodontics, endodontics, which is orthodontics, which is braces, endodontics, which are root canals, to general dentistry, and probably everything in between. So I'm pretty experienced in the dental field. It was an interest of mine. I don't know why teeth were so interesting to me, but they were. So I think it's really important that we take care of them. And I want to talk to you guys about brushing, flossing, whitening, and just overall oral hygiene. Even though I haven't been working in the dental field for a number of years now. But it just so happens that my daughter sent me a picture yesterday of her tooth in her hand. Well, what she thought was her tooth. It was actually her filling. And she is a broadcast journalist in Montana. So she lives in a whole nother state. And she, because of the quarantine, she's like, "Mom, what do I do?" So I said, you know, either you can find a dentist and he'll do something temporary for you to hold you over, or you can go to the pharmacist and grab some temporary filler until you can get to a dentist when they open up. So anyway, I wanted to share some things that you can do that will help take care of our teeth and our gums and our oral hygiene overall. So you guys stay tuned. So since we can't get to the dentist at this time because of the quarantine, it's going to be extremely important that we do everything that we can to take care of our teeth and our gums in the meantime. Typically, you would go to the dentist every 6 months. Maybe adults are going once a year, but 6 months is probably the best. It's best that we take really good care of our teeth. There's some really awesome tips that I want to share that will hold you over and help you with your oral hygiene until you can get to the dentist. I have AIM, Colgate, Crest, so obviously I haven't committed to a brand. You guys have to choose what brand works best for you. Floss picks are so convenient. I have bags of them. I keep them in my purse, in my car, in my desk drawer. They are really handy. You can just grab them and floss whenever you need to. You're supposed to floss at least once a day to keep the plaque from building up on your teeth. Oral hygiene is extremely important for your overall health, not just your mouth. Flossing, it could actually keep you from getting a heart attack. If the plaque from your teeth get into your bloodstream, that plaque could travel to your heart. I personally floss in the morning, after lunch, and before bed at night. It seems like a no-brainer, but here's an example of flossing. You want to gently glide the floss in between your teeth, down below your gum line, and then back out. On the opposite side, there's a pick, so you can also use that. But whatever you do, whenever you're working in your mouth, you do want to do it gently. You could damage your gums by being too aggressive, and that would cause recession, where your gums are actually pulling away from your teeth. If you have bleeding gums, then more than likely you have bacteria and plaque underneath the gum lines, and you need to floss more often. Okay, so here are a couple of toothbrushes, and you always want to use a soft bristle toothbrush. And I usually keep a toothbrush cap on my toothbrush because there are debris floating around in the air, and I want to protect my toothbrush. It will be going in my mouth. So if you're using a manual toothbrush or an electrical toothbrush, protect them with the caps. This is my Sonicare electrical toothbrush, which I love. I actually worked with the doctor that invented this toothbrush many years ago. But anyways, this one has a cleaning setting, a whitening setting, and the reason I like it is because these bristles they'll move a lot faster than you could when you're using your manual toothbrush, so the cleaning is going to be that much more efficient. This toothbrush has an intermediate timer, so you'll know when to switch quadrants, different sections of your mouth, and a shut-off timer, so you will know when to stop brushing. This toothpaste I like because it has the baking soda and the peroxide in it. So when you brush with it, it penetrates beneath the enamel of your teeth and it helps to remove surface stains. And as I said before, when you're brushing with any toothbrush, you want to hold your toothbrush at a 45-degree angle and you want to gently brush in a circular motion, sweeping down away from the gum lines, or if you're brushing the bottom, you sweep up away from the gum line, and you do it very gently to avoid damaging the gums. So this little tool here comes in a variety of styles. It is a tongue scraper, and it's used to do just that. Scrape your tongue and remove bacteria, and also it helps to keep your breath smelling fresh, and you basically just use it and gently scrape the tongue and rinse. So when it comes to whitening your teeth, you're gonna have to choose a system. I'm using trays that I actually made myself and some peroxide gel. I believe mine comes with 15% peroxide. But anyway, you're gonna load it inside the tray, and you don't need very much because once you put the trays inside of your mouth, the gel does tend to ooze out, so a little does go a long way. There's a lot of systems out there on the market, but they all come with peroxide in them, so they're all going to do the same thing. I guess the percentage of peroxide is what you would be concerned about. That kind of determines how long you're going to keep the trays in your mouth and how long the gel is effective, and then also how sensitive your teeth are kind of will determine how long you want to wear them as well. So you would whiten your teeth until you arrive at the desired tooth shade that you're going for. Definitely follow the instructions that comes with your whitening kit. But there is another option if you don't want to buy a whitening system. You can use some things that usually we have in our homes, which is your toothbrush, some baking soda, and some good old peroxide. These are the ingredients that are actually in the toothpaste, and you're just going to make a water, baking soda, peroxide paste and use that to brush with, and it actually does a really great job of removing the surface stains caused by like coffee or if you drink wine. It'll get those stains off of your teeth. So the toothpaste that I like to use has baking soda and peroxide in it, and those two combinations are what whitens the teeth. And what I like to do for my 8-year-old is make my own paste. I will use baking soda and peroxide mix and brush his teeth and accomplish the same thing. So here I am with my trays in. I usually whiten in the evening. I'll have my dinner, I'll brush and floss, and I'll pop my trays in. I sleep in mine, and the reason why you can do that is because the peroxide is only active for a certain period of time, so it's not really gonna damage your teeth. It will stop working after a while anyway. You'll just be wearing trays. Lastly, we have a night guard that prevents you from clenching and grinding your teeth. Don't forget to brush and floss daily. Don't forget to brush and floss daily. I know a lot of people don't like to floss, but floss the ones you want to keep. Thank you guys for watching. Please like, comment, and subscribe. Until next time, bye.